Serious healthcare concerns can be scary enough without the concern over large medical bills and insurance woes. So one question we get asked very frequently is, what Medicare plan is best for cancer? So that's what we're going to talk about in today's video. So as always, if you have any questions whatsoever about Medicare or health insurance in general, you can reach us in the comments below or at the number on the screen, and we are more than happy to help. Now, we do release these videos on a weekly basis, so make sure to subscribe to stay up to date, and please click that like button so we can get this very important information out there to others looking for the same type of information. All right, so let's dive into today's topic. Now, there are multiple parts of Medicare, so we're going to break down each of these parts and how they work with a serious and potentially long-term illness such as cancer. First, we're going to start with Medicare Part A, which is basically your hospital insurance.
So let's talk about what Part A covers and then talk about what the costs associated with Part A are. So Part A, as I said, is basically your hospital insurance. So it will cover any inpatient care in a hospital or a skilled nursing facility. Now, a skilled nursing facility is not long-term or custodial care. It says that here as well for nursing home care. Basically, it is for after you've been hospitalized for an injury or an illness and need to recuperate for some period of time if you need skilled nursing care. So it's not just somebody to help you walk around, help you with meals, help you to the bathroom. It's if you need dressings changed or IV medications, etc. Part A will also cover hospice care and home health care if you are homebound for any particular reason, but require some type of skilled nursing care. Now let's talk about the costs. So the costs are broken down into premium, deductible, and then copays or coinsurance for each type of care covered under Part A. Now, as far as the premium, actually most people don't pay a premium for Part A. If you qualify for premium-free Part A through yours or your spouse's work history, basically, that would be if you or your spouse have worked at least 40 quarters, which breaks down to about 10 years, then you won't have to pay for Medicare Part A. If you do have to pay for Medicare Part A because you don't qualify through yours or your spouse's work history, honestly, it can be pretty pricey. If you've worked somewhere between 30 to 39 quarters, then you would pay $278 per month. If you haven't yet hit 30 quarters, then it would be $506 per month. But let's focus more on the costs associated with your actual care. So first, there is the deductible. In 2023, the deductible for Part A is $1,600. Now that is per benefit period, not per year. So those benefit periods, there can be multiple benefits per year if you have to be hospitalized multiple times in a given year with 60 days in between that you're not hospitalized. So if you are hospitalized for a procedure or for a condition and then you have to be readmitted within 60 days, then that would still be within that same benefit period. But if there's a 60-day lapse, it would now be a new benefit period, which means you would have to again meet that deductible. Then there's coinsurance. So it's different based on if it's inpatient care, skilled nursing facility care, home health care, or hospice care. If you are an inpatient in the hospital, so you have been admitted into the hospital, there's actually no coinsurance for days 1 through 60 after you've met that deductible. For days 61 through 90, if you are still in the hospital, it is $400 per day. For days 91 through 150, it is $800 per day. And if you have to stay for more than 150 days, you would pay all costs. Then there's skilled nursing facility care. So if you've been admitted as an inpatient and now you're going to recuperate in a skilled nursing facility while receiving specialized care, for days 1 through 20, $0 again. 21 through 100, $200 a day. 101 days or more, you pay for everything. Home health care, it's actually $0. There are specific rules for home health care as far as how long you can receive home health care, how many days of the week, how many hours per week, etc. And then there is hospice care, and that's $0 for hospice care services.
And then there's Medicare Part B, which is your medical or outpatient insurance. And basically, it is anytime a doctor is involved.
So let's take a look at what Part B covers, and then we will look at the costs associated with Part B. So first you'll notice that Part B covers two types of services. So these are medically necessary services and preventative services. Preventative services usually will have no cost associated. So when we talk about the cost associated, usually we're talking about those medically necessary services. So diagnostic services and treatments for your condition. Now, if you scroll down a little bit more, you'll see that Part B covers things like clinical research. So if there's a promising study for your particular illness, then Part B would cover clinical research studies. Part B will also cover ambulance services if you need to go to the hospital and you're unable to drive yourself. It will cover durable medical equipment. So these would be things like wheelchairs, walkers, canes, etc. It will also cover mental health services and limited outpatient prescription drugs. Now, for the most part, Original Medicare does not cover prescription drugs, except in very limited instances. And one such instance is cancer. So let's take a look at those drugs covered. If you scroll down, you will see that the new Alzheimer's drug, this was actually very controversial, would be covered by Part B. Drugs used with durable medical equipment, so like if you have an insulin pump, the insulin administered via pump would be covered. Some antigens, osteoporosis drugs, drugs for end-stage renal disease, blood clotting factors, that can be very important. Injectable and infused drugs. This is very important when it comes to somebody that is fighting cancer, because this would be chemotherapy. This page can be found on Medicare.gov if you'd like to look further into all of the drugs covered by Medicare Part B. But if you scroll down, you will also see that oral cancer drugs are covered by Part B, and also oral anti-nausea drugs. So that's very important. If you are taking chemotherapy, very often anti-nausea drugs are prescribed, and that would be covered by Part B.
Part A and Part B are Original Medicare. You can think of them as your default option, and it's likely that you may even be automatically enrolled. However, there are other optional parts of Medicare that we want to discuss as well. So first there's Medicare Advantage, which is also known as Medicare Part C. Now, Medicare Advantage plans are a replacement for Original Medicare, so they are an Original Medicare alternative. They must offer at least the same benefits as Original Medicare, but they may offer many additional benefits as well, things like dental, vision, hearing, prescription drug, and more. Because yes, remember, Original Medicare really doesn't cover prescription drugs. When you compare Medicare Advantage plans to Original Medicare alone, it's likely that you'll have lower copays or coinsurance and lower deductibles, and you will have some type of out-of-pocket maximum, which is just not offered by Original Medicare alone. And this is especially important when dealing with a major medical issue that may have major medical bills involved. However, there are definitely some major and very large drawbacks with Medicare Advantage, and this is especially important to take into consideration if you are dealing with a serious medical concern such as cancer or another serious illness. First, there is the issue of networks. Now, Medicare Advantage plans are private insurance plans, and although yes, you may be getting access to additional benefits not offered by Original Medicare, you will have to operate within some type of network. Now, there are HMOs and there are PPOs. If you're unfamiliar, an HMO, basically you only have benefits in network, except in the case of a true medical emergency. With a PPO, there is more flexibility. You can go out of network, but it will be more expensive if you choose to go out of network. That being said, if you are dealing with a serious medical concern, you want to have the full range of doctors and hospitals available to you. Most doctors and most hospitals accept Original Medicare. The same cannot be said of Medicare Advantage. And if you are someone or the loved one of someone who is experiencing a serious medical concern such as cancer, then it would definitely be in your best interest to have available to you the full range of doctors and hospitals as opposed to having to operate within a restrictive network. There's also the issue of referrals and pre-authorization. Referrals really only apply to HMOs. Basically, if you choose a Medicare Advantage plan that is an HMO and you need to see a specialist, which you would need to for cancer or any other type of serious medical concerns, then you would need to first go through your primary care physician to get a referral to your specialist. This is basically just one extra step, maybe one extra phone call, one extra doctor's visit, that when you're already pressed for time and concerned about your health is just something that's adding to the stress in that moment. And then very often, doctors, even though they know that they take your health insurance, sometimes they go to refer you to a specialist and you don't find out until after the fact when you go to make that appointment that that specialist doesn't accept your insurance. So basically, it's just a bit of a headache. And then there's pre-authorization, which is more than a headache. So let's say your doctor has arranged for you to meet with a specialist, and this applies to HMOs and PPOs, the issue of pre-authorization. If you go to meet with that specialist or have a certain procedure or service provided by that specialist, your insurance plan may decide that it needs pre-authorization. It may determine that you don't actually need this service, which your doctor may have considered to be medically necessary. Now, yes, there are often ways to get around this, but again, this is more waiting and more phone calls, which when you were experiencing serious medical concerns, a serious medical illness, this is absolutely not something on top of that you want to have to deal with. Medicare supplement plans are far more popular than Medicare Advantage plans, and we will touch upon that later in the video, but especially if you are someone with large medical needs, then please proceed with caution when it comes to a Medicare Advantage plan. That being said, if a Medicare Advantage plan will work best for your needs, you can of course enroll when you first become eligible in Original Medicare. You can enroll during a special enrollment period if you qualify, or during the annual enrollment period, which is every year from October 15th to December 7th. You can view all of the available plans on Medicare.gov, and the benefits do vary quite widely, so we recommend that you work with a broker. Now let's talk about Part D, which are strictly prescription drug plans. Because yes, remember, Original Medicare actually doesn't cover most prescription drugs. That being said, many cancer treatments will actually be covered by Part B, but you may still have additional prescription drug needs, so in that case, you would definitely want to look into a Part D plan. Like Medicare Advantage, these are offered by private carriers, and you can enroll when you first become eligible for Original Medicare, during a special enrollment period if you qualify, or during that same AEP, which is again October 15th to December 7th. Now, I'll be honest, Medicare Part D is probably the most confusing part of Medicare to understand, but I will try to break it down in detail right now. If you want to learn more, we do have a video dedicated entirely to Part D, so make sure to check that out as well. Basically, Part D plans are strictly prescription drug plans. You will pay an additional monthly premium to have access to lower cost prescription drugs. The cost of your prescription is determined by the tier of the medication. There are 5 tiers, and as you move from Tier 1 to Tier 5, the costs will get more expensive. You will likely have a deductible to meet, although many plans will offer a lower deductible or possibly no deductible, and usually there isn't going to be a deductible for those lower tier medications. I know, I told you, it is a little confusing. Additionally, the cost of the drug is determined by the stage that you are in, and these are basically financial stages. Medicare is keeping track of your spending on your prescription drugs. After you meet your deductible, you'll move into the initial coverage phase, and at that point, the cost for the drug is determined by the tier of the medication, but also by the fact that you were in that initial coverage phase. As you continue to spend, you may reach the coverage gap. At that point, you'll notice that your prescriptions do jump up quite a bit. But if you continue to spend, and again, Medicare is keeping track of this, you may reach the catastrophic coverage phase, at which point the cost for any of your prescription drugs is going to drastically decrease. But remember, this will reset when your plan resets. Now, even with the quote-unquote best Medicare Part D plan available, prescriptions for a more expensive condition to treat or more complex condition to treat can just be more expensive. That being said, there are ways that you can get around this a little bit. There are state pharmaceutical programs, pharmaceutical assistance programs, and make sure to ask your pharmacist when you go to fill your prescription. There are things that can offer you coupons that may significantly lower the cost of that prescription drug. And of course, you can always talk to your doctor about your specific financial concerns. They may be able to provide you with a generic, which is always going to be less expensive, or perhaps offer a different course of treatment, perhaps something through Part B that might be significantly less expensive. Finally, and perhaps most importantly for this video, I want to talk about Medigap plans, also known as Medicare supplement plans. For somebody with a long-term or serious medical condition, these are really the gold standard for Medicare. You can enroll in a Medicare supplement plan that will help to cover or possibly entirely cover your copays and coinsurance and deductibles with Original Medicare. Remember, with a Medicare supplement plan, although these are offered by private carriers, there are no networks. They're just there to supplement your Medicare coverage, fill in those financial gaps. So if your doctor or hospital accepts Original Medicare, and almost all of them do, then they will accept your Medicare supplement plan. So unlike Medicare Advantage, there are no networks, no pre-authorization, no referrals, no waiting around to get the care that you need. As always, if you have any questions whatsoever, please feel free to reach us in the comments below or at the number on the screen. Now, we are licensed health insurance brokers. We're licensed nationwide, and there is absolutely no charge for our services, so please feel free to reach out with any and all questions. But before you go, please make sure to subscribe to stay up to date, and yes, click that like button so we can get this very, very important information to others looking for it as well. As always, have a wonderful day, and thank you so much for watching. Bye-bye.